All right, good morning, everybody. My name is Becky Kinnaman, and I am a broker advisor at Cornerstone. We are joined today by UnitedHealthcare for the launch of their 2022 Ohio Chamber MEWA product. But before we get started, I have to cover a little housekeeping. If you have any questions throughout the presentation, be sure to leave them in the chat box on your GoToWebinar dashboard, and we will answer them at the end of each session. All right. Cornerstone's agency services program is designed to help you make a plan for your business, your clients, and your family, no matter the situation. Among the services provided in ASP are the autopilot client referral plan, parachute scanning, flight plan retirement assistance, and co-pilot service agreements. Contact your plan representative today for details. If you haven't already heard, Cornerstone recently partnered with EB3, an online benefit booklet builder system that is fully customizable and specifically designed with employee benefits brokers in mind. As a Cornerstone broker, you have exclusive access to this product. Contact your Cornerstone representative for details. Visit our website at www.crnstone.com/EB3. Now I'm going to turn it over to UnitedHealthcare.
Hello, everybody. My name is Ed Lightcap. I'm a small group sales rep in the Northern Ohio market. We also have Ray Gazinski on, that is the small group sales rep in the Columbus office. And we're here to talk to you today about the exciting changes that we have just in small group in general, mainly with our MEWA product. But we also are going to talk a little bit about All Savers and our ACA product going into 2022 to just make you aware of everything. Now, one thing that we realized as a company is last year we really didn't see in the small group department that many groups quoting business out. A lot of groups with what was going on decided not to shop. There's a number of groups, I think it's around 40% of the market is still under transitional relief plans, and they've been getting kind of manageable increases throughout the last 7 years, haven't really hit the market that much, and are just comfortable taking their nominal increases, let's say year to year. We really didn't see a lot of the market shop last year. A lot of them have transitional relief plans. And we really thought about what we can do to have some of those groups go to, shop the market with our MEWA. So we have some exciting things to talk about, because when we've taken a look at groups that have traditionally just renewed as is with transitional relief, they've been doing that for so long, sometimes their rates have actually caught up and they don't realize it. And with our Ohio MEWA, we can see sometimes up to 25% savings for groups that are currently on transitional relief. So we'd love to get a chance to quote some of that business with you. And we've designed our MEWA to make it a lot easier. One thing just to point out is that in order to sell the chamber, we will both need the group and your broker agency to be a member. We can always do this at the point when we're actually selling a group. So it doesn't need to be anything where you need to join right away. For employer groups, the rates are right up there and they are discounted $100. So the chamber is giving a $100 discount both for brokers and employers on their first year. And the rate is based off of how many enrolled employees are enrolling in the MEWA medical coverage. So you got a group of, let's just say 15 employees, but only 10 are enrolling in the medical benefits with the MEWA. They will have to pay $150 for that initial membership, and then it'll go up $100 after they renew. And then your agency would also have to join if it's already not a member. The standard membership is $400. That's including the $100 discount. If you'd like the preferred membership, which is going to allow your logo to be on the chamber's website with the link, then it's going to be $900. And that's really up to you what you chose. Now, one thing that's really important to talk about the Ohio Chamber MEWA program is it does have a common renewal date of January 1st. So every single piece of business always is going to renew on 1/1. For those of you that are selling some business anywhere between the months of 9/1 to 12/1, so fourth quarter and the 9/1, Just to let you know, those specific sales, what we're going to do is we will release to you maybe a couple weeks after you get the welcome letter, and it will be the renewal rates for the plans they're on. So we're going to renew you as is on January 1st, and we'll provide that rate within a couple weeks after installation. That rate should be at a rate pass or better, just to let you know. Now, one thing that we're really excited about with our MEWA in small group product is how many value adds we really bring to the table with our small group package. Each one of these check marks are kind of important value adds that we have with our Ohio Chamber product. Virtual visits are listed on there twice, one for medical, one for behavioral health. Obviously, that's been an enormous benefit, especially last year during the COVID times when lockdowns were happening. But we have so many other useful tools, Quit for Life, which is to stop smoking. We have healthcare cost estimator tools on our website and our apps. All of our HSA plans have our motion program, which is where you can earn up to $3 a day by meeting certain walking requirements. We have Real Appeal, which is a 52-week online weight loss program that we see significant not only participation, but people actually losing weight and keeping it off. And a couple new things that have happened recently is we've introduced what we call a Peloton membership that we allow our chamber members that are enrolled a free year of Peloton membership. That started on 9/1. And then we just announced also Apple Fitness Plus membership that is going to start on 11/1. So a lot of useful value adds for just not only medical plan through the chamber, and we're really proud of these extra services that we provide, not only you to sell your groups, but members that are enrolled. Now, another thing that we did is we really simplified our medical portfolio of plans. So starting January 1st of 22, we will have a product portfolio with the MEWA that is just 10 plans. We really looked at what plans groups are taking, what plans are competitively priced, and instead of just throwing a whole bunch of plans at you and on our quotes, we decided, hey, you know what, let's make an easy, simplified portfolio where we know they're proven plans that people have been taking. So if you look on here, we only have two types of classifications of plans. First would be our Premier Performance plans, which are basically PPO style plans. These are our top selling plans, not only with a MEWA, but also with our ACA products and with products in other markets, other states. If you look on, we make it really easy. We have a couple 100% co-insurance plans and 4 80% co-insurance plans. We wanted to make all the benefits uniform and those services that people use the most often at low cost. So if you look at PCP office visits, for adults, it's $15. For children under 19, it's $0. If you look at urgent care, it's $25. Tier 1 medications, $10. So the most commonly used services are at very low, rich benefits. We designed our program that way. And then if you look at the HSA plan, we have 4 different HSA plans, all with 100% co-insurance. We have been marketing plans at 80% co-insurance over the years, and they did get a good price point, but the market did not want them. So we decided not to clutter up our quotes by putting a lot of plans out there that traditionally aren't going to be sold. So one thing to let you know, this is what we call a multi-choice package, which basically means you can sell as many plans to the group as you would like. So there's 10 plans available. You can sell up to 10 plans to your small groups. And we use the essential PDL for our prescription drug list with the MEWA, but we did move to the essential PDL with our chamber last 1/1. Another way that we're making things easier is that we actually have 2 different ways that we can underwrite chamber groups right now. The one is the traditional way that we've always been doing, which is employee applications. One thing that we do during the busy season, we've been doing this for the last 10 years, probably or more, is we understand during the busy times, fourth quarter for 1/1 effective dates, some people like to get applications done a little bit earlier. So we allow our applications to be up to 120 days old, good through 1/1 effective dates. It will go back to 60 to 90-day requirement for February 1st. And then we accept all forms of applications, form fire, easy apps, paper apps, And sometimes we see form fire applications with 1 or 2 paper apps because somebody didn't want to do the form fire, and that's completely acceptable. But we do have a new way that we just announced to try to make it easier for groups. So we are going to be doing member level census underwriting for certain type groups. And that's going to be groups that have 10 or more enrolled employees, groups that have current medical coverage, so virgin groups would be excluded. This is good through 1/1 effective dates right now. We are going to probably be reevaluating this in the next couple months to decide if we're going to keep extending this past January, but we wanted to hit the market right away because we know January is such a busy effective date. And the things that we need, just to let you know, is a member level census for every enrolling member. So that would be employee, spouse, or children. The only thing we need is first and last name, their gender, their date of birth, and their home zip code for all those enrolling members. I commonly get questions like, hey, how about social security numbers? We do not need social security numbers. So as long as we have a census of all the enrolling employees and it has those data points, we're going to be good to be able to provide you an underwritten rate. Now, a common question I've got since we've rolled this out is, hey, Ed, which way should I go? In my opinion is if you have employee applications, you should always submit those. I feel we're probably going to be able to price the group and get the best discount possible by having those applications. But if you don't have apps, it's going to be an avenue for you to be able to shop and underwrite groups that refuse to complete applications. Once you submit a group to us, just to let you know whether it's with apps or a member level census, we will continue through the rest of the time with you with that form of submission. So if you're going to underwrite the group with a member level census, we're going to install it that way. And conversely with the apps. A couple other things that we've done to make us easier to quote is we've changed our participation requirement under MEWA. We used to be 50% of all eligible employees had to enroll. We really didn't look at why people waived coverage, just half had to enroll. We've gone to what the market is used to, and that is 75% of participation by taking out the valid waivers. So we just wanted to let you know this. We still have the participation of 50% for all savers in ACA, but we've changed the MEWA to be able to quote more businesses because over the last year, we've declined to quote a number of pieces of business just because of participation requirement, and we wanted to change that to make it easier for all. Now, one requirement that the chamber has is that it has to be an Ohio situs group. So the group has to have a physical location in Ohio, and at least half of the enrolling employees have to live in Ohio too. Since it is being sold through the Ohio Chamber, we need to make sure it's an Ohio group. Now we do have an access fee of $7.50 that goes to the chamber. It will be billed on the invoice, and we do represent that charge on our quotes. If you look at, there should be a line that says association fee. That is going to be whatever that number is $7.50 times the number of enrolling employees. And a couple other few things. We don't get this that often, but we do have we can write 1099 employees with our MEWA. They cannot make up more than 25% of the enrolling population, so we do have that possibility. Just reach out to your Cornerstone rep to talk about that. With our MEWA, we do all the ACA reporting, so things like 1095 and PCORI, that's something that UnitedHealthcare and the Chamber does, so you don't have to worry about that. Commissions are $30 per employee per month for the MEWA. And all the MEWA groups are considered to be 51 plus. So since it's being sold under the umbrella of the chamber, that's going to mean that every group is COBRA eligible and the plan is primary. The nice thing about that is UnitedHealthcare has a company called UnitedHealthcare Benefit Services. They do COBRA administration for groups. We automatically enroll MEWA groups into our free COBRA administration. If it's something that you do not want, you would just need to let us know and have a sign off saying you do not want to use our COBRA administration. But for the MEWA programs itself, we automatically enroll groups into our COBRA services. Next, I'm going to pass it over to Ray Gazinski, and Ray is going to talk about our All Savers program. Ray?
Thanks, Ed. So my name is Ray Gazinski, and I will be going over All Savers. As Ed mentioned, the MEWA really is our lead product in the state. But All Savers, I work at UnitedHealthcare, but I'm pretty biased. And when it comes to a bells and whistles perspective, I'm not sure that there's a better fully functioned product in the market. However, All Savers is max funding the claims liability at 125%. So unlike a lot of the other places around the state, around the country, the MEWAs are able to get to a much lower price point. But there is an opportunity for many groups to go over to All Savers. And the way I think about All Savers, and I'm sure many of you are very familiar, it's been around for a long time, is we have all the benefits of being self-funded without any of the risks. So you're going to get a fixed monthly premium, the opportunity for a surplus refund upon renewal. You're going to get a 1260 contract, which is incredibly long. A 5-year run out on that is very long, but it's really just to reassure the groups that there is no liability on the back end at all. And you're going to be able to see claims and utilization reports, which, for many small groups is not an option. On top, on top of a very robust benefits package. Next slide, please. And All Savers is nationally marketed. So Ohio is pretty unique in all of the different MEWAs that are available, but it's pretty unique to the state of Ohio, and they're starting to pop up around the country. But All Savers is the lead product and incredibly competitive around the rest of the country. So you'll see that California is coming on as of 11/1 effective dates, and Montana will be coming in 2022. Which only really leaves Hawaii, Vermont, and New Hampshire as outliers, with All Savers not being available. So as you're looking at prospects outside the state of Ohio, consider All Savers. It's one of the best products out there, and it is very competitive around the rest of the country. Next slide, please. One of the exciting things that we're rolling out again this year, it's been very successful in the past, is the rate guarantee. So groups that are written between 11/1 and 1/1 with 11/1 or 1/1 effective dates are going to be eligible for either 12 or 15-month rates. Those rates will be the same, and the group would just make an election at the time of installation whether or not they want 12 or 15. There's been a handful of groups that have wanted to stay on a 1/1 effective date that have not taken that, but I would say that 90% of the groups have moved to the 15-month rate guarantee. So it's been a very successful program that we've done for about 3 years now that we're continuing again this year. So again, all groups with an 11/1 through 1/1 effective date have the rates that you receive are good for either 12 or 15 months. That's a decision that you and the employer are going to make during that process. Next slide, please. And as I mentioned before, All Savers really has one of the most robust wellness offerings available in the market for small groups. So it comes with Rally, as does all of our small group programs. It comes with Real Appeal, which is a 52-week online weight loss program that gives a bunch of different options for people to engage, whether or not it's one-on-one coaching, group coaching. Everyone who is involved is going to receive, or enrolled is going to receive a large box filled with different weight loss tools. And the idea behind this program is really to make small incremental lifestyle changes that are going to help people lose weight and lower their overall BMI. This is a program that has stemmed from our previous diabetes management program that has been rebranded by the same people who made P90X and Beach Bodies. And it's a really good program with a lot of good results that is now available on basically everything that you would write with UnitedHealthcare, and it's free on All Savers as well. But I think that the two biggest things to point out are UnitedHealthcare Motion and Healthiest You. UnitedHealthcare Motion is something you're probably familiar with from the All Savers platform, and which has now come to all of the HSAs kind of across the board on our fully insured plans. But remember that Motion is available on every single plan on the All Savers platform, whether or not it's a PPO, HSA, or otherwise. It works a little bit differently with a non-HSA on a PPO plan. It's going to work a little bit more like an HRA, but it's going to be available on every single plan, which is a huge advantage to the All Savers product, and employers and employees both really enjoy it. And then also Healthiest You. Healthiest You is a $0 virtual visit functionality which would rival even the best out there. Teladoc is what we use on fully insured, but I think Healthiest You is right on par with them, if not better. But Healthiest You is available for free on all PPO plans. But one change to note is that as of 1/1, we will no longer be offering that free service to HSA plans, and it'll be it's a 45 or 49. Ed or Donna or Whitney, correct me. I can't remember which it is, but it'll be moving to a copay, $45 or $49 copay as of 1/1.
It'll be 45.
Next slide, please. So one of the things to note is that we've really tried to streamline the quoting process. So whenever you submit an Ohio Chamber MEWA RFP, whether or not that's with apps or with the member level census, we will automatically quote All Savers for you. So with a single submission to Cornerstone, Cornerstone will be able to quote both of those for you. And in the event that neither one of those are competitive, Cornerstone will be providing you with an ACA proposal. Even though the MEWA has gone to 75% net participation, All Savers and the ACA are not. So remember that All Savers participation is still 50% of the total eligible employees. So we're not considering waivers at all. We talked about the 15-month rate guarantee. Starting with 9/1 business, the essential PDL is going to be the default PDL that we're using. With All Savers, you have the option of using the essential or the advantage PDL. While the advantage is a little bit more robust, there's about 200 additional drugs that are included. It is about 3% more, and we found the essential to be the lead product around the state and quickly growing around the country with little pushback from brokers or employers or employees as well. Note that there is the pharmacy network is being utilized as a standard select with Walgreens on All Savers, and that is with either the Advantage or the Essential PDL. And the standard select network with Walgreens essentially excludes CVS and Target from the network, and I think Ed's going to talk a little bit more about that briefly. There are the EPO plans that are available. The EPO plans are in-network only plans. There's about a 3.5% savings that are available. Note that in the state of Ohio, we have a 98.5 or 6% in-network utilization, with every hospital system being in-network. If you're in one of the major metropolitan areas, even if you're not, but it's a no-brainer if you're in one of the major metropolitan areas, because your employees are not going to go out of network. I think that it's something to think about if there's a little bit more spread out, but that's a disruption report that you can work with Cornerstone and your UHC account executives to see if that's a good solution. And finally, all of the plans, if it is a group that is COBRA eligible with All Savers, COBRA administration is available through United Benefit Services at no additional cost. Next slide, please. And I think that's it, and I'll kick it over to Ed to talk a little bit more about the ACA product portfolio for 2022.
Yeah, so thanks, Ray, so much. The ACA portfolio is something where we were going to start quoting last week, but there was a problem with our quoting system. So just to let you know, we will be quoting 1/1 ACA shortly. We're just trying to work something out. But what we did for our package this year is, for those that really know us, they know that we have 3 different multi-choice evolution packages that we've quoted in the year of 2021. We are condensing that, so there will be one evolution package. You don't have to worry about which one of the 3 should I quote. So it'll be a lot easier for you when quoting. One thing to definitely point out, though, is we have a few different licenses, let's just say, in other packages that we really just use for existing groups and do not quote for new business. We could quote it for new business, but it's not going to be as competitive. So if you're ever seeing something for new business and it's either the Heritage or the Legacy package, I would say don't look at those and just look at the Evolution Package 48. Those are our most competitive plans and our most competitive rates. With our package 48, we can sell as many plans you want that's in that package. So, you don't need to ask us, hey, can I sell 2 plans or 3 plans or 4? You can sell as many plans you want as long as they're all in that same multi-choice package. We are going to be moving. We've already moved to the essential PDL with our ACA programs, but we are going to be moving to the standard select network with Walgreens as the anchor that we've also done with All Savers that Ray mentioned. And the next slide is going to go over a little bit about that network. And then also within our plans, ACA plans for 1/1/22 effective dates, we will have a new benefit that this is going up into key accounts as well, called designated diagnostic providers. And one thing to point out, this program is going to be excluded for All Savers and our MEWA, so it's really going to be just ACA business only. Now, as Ray said, and as I said, we are moving our pharmacy network for ACA and All Savers to the standard select network. Basically what that is that's a smaller subset of the pharmacies that we contract around the country. And I hate to use the word small, to be honest with you, because it's still really large. So when we look at what we call our standard select network with Walgreens as anchor pharmacy, if we looked at every single pharmacy we contract with in Ohio, over 80% of everyone that we contract with is in this network. As you can see, we bullet point all the big ones that people ask about and all the major chains, Cleveland Clinic, pharmacies, Costco, Drug Mart, Giant Eagle, Marks, Myers, Rite Aid, Sam's Clubs, Kroger's, Metro Health, Walgreens, and Walmart. They're all participating. The big exclusion is just CVS's are not included. That would also include Target, since Target's pharmacies are CVS as well. And then if you look at what else it is other than CVS that isn't in the network, it would be a handful of like mom and pop pharmacies across the state. So it's really a robust network. It's just excluding CVS. And again, this is for All Savers, new business that we start selling 9/1 in now, and then ACA plans if they move to a 2022 ACA plan. The next rest of slides are to talk about our designated diagnostic provider program. I have a lot of slides here. I'm not going to dive deep into each one. Again, this is for fully insured benefits, so it includes ACA, but it will exclude All Savers is not part of this, and also the MEWA is not part of this. But basically what this is, we have to be conscious of costs nowadays, and lab work is one that we really want to focus on. At UnitedHealthcare, mainly in key accounts, we had what we call preferred lab networks, and 81% of our membership had access to a preferred network. It's kind of taking that and going to the next step. Who's in these network? All the big chains. So if you see on the right, LabCorp's involved, Quest Diagnostics involved in the preferred lab network. Now that we're going to rebrand it designated diagnostic providers, qualified freestanding labs are also going to be included in this, and qualified outpatient hospital labs are also going to be included in this. And then, everybody with the question we get is, hey, why are you doing this? We have to look at cost as a whole system. 70% of all decisions are based on diagnostic lab work. So we want to make sure that the labs that are being done are at the highest, utmost quality, and also at a fair price to our members. This is just a little, let's just say, upside down triangle that shows kind of how it's going to work. So if a member is going to get some lab work and it's done at one of our DDP labs, they're just going to pay their normal in-network level benefits. Most plans nowadays have lab and x-ray covered at deductible co-insurance. If somebody would go to a lab that's in network with us, but they're just not designated as a DDP lab, that person will still have in-network coverage. It'll be at a reduced cost, and usually that reduced cost is going to be deductible and 50% co-insurance. So it's still similar, but it's just going to be the co-insurance amount is going to be reduced. And then if they go to an out-of-network lab, they're just going to pay what their normal out-of-network benefit would be, which is going to be a lot more. So again, trying to steer our members into our lowest cost, highest quality labs. They're accessible everywhere. So it should be a really good program that not too many people find hard to use at all. A question we get too is, hey, I go to my physician's office and I get my lab done there. How is that going to be covered? If they're drawing if it's being done in the lab and it's sent out for analysis, you want to let that provider know that they should be sending it to a DDP approved lab. But in the scenario where they just do it right in the physician's office, that will be a DDP office, and they don't have to worry about the higher cost. There's also going to be some exceptions where it really doesn't come into play. So emergency room visits, an observation event, inpatient, chemotherapy and cancer treatment. So it's not every time labs are done. We do put on the very bottom of their products that are excluded, and obviously there's a number of them throughout UnitedHealthcare. I've put on there, added, you can see the Ohio MEWA and All Savers is listed on there. Again, this is going to be for ACA only business in the small group realm, but this also goes up to key account fully insured products as well. Now, a couple of good things that we're doing as well is obviously anytime you change a benefit, we want to make sure that we're notifying our members in a promptly time. So for members that have used non-DDP providers in the last 12 months, we will reach out to them and let them know about this change and that the place they went to was a non-DDP provider, so they can make an educated decision in the future. Also, the new ID cards they get will have a DDP indicator on the ID card. When people go online and do a lab, let's just say search on myuhc.com, as you can see, there'll be a green check mark that says designated diagnostic provider to let them know it is. We will highlight and show the DDP labs on the very top of the search. So we always want people to know. We will have real-time messages for members that they've had a benefit change to when they log into myuhc.com to let them know about this change as well. And a really nice thing that we're doing is obviously we know sometimes some things are going to slip through the cracks. Somebody's going to go to a non-DDP provider and not be aware of it, and then get charged and get their bill back and maybe have a higher than expected claim. We are going to, for those members that reach out to our customer service when this happens, a one-time exception to cover it at the DDP provider rate. So again, we're going to do member communication. We're going to let people know about it. But ultimately, if it happens and they go to one and they weren't aware, we are going to make a one-time exception so they know about this change and it won't cost them any difference. So again, this is something we're doing for key accounts as well. And that's really it for ACA, but I really just wanted to end with with UnitedHealthcare, we have the 3 different products in small group that we sell. We have our MEWA, we have All Savers, and we have ACA, and they meet all different type of needs. I would say definitely our most competitive product is going to be our MEWA. And then All Savers is not going to be as competitive as the MEWA, but there's some bells and whistles to it that help push it, whether it's the 15 months that we're doing right now, motion be included on all things. We can quote All Savers in every single state other than 2 or 3. And the MEWA is obviously only in Ohio. And then ACA is really just the fallback if we can't get an underwritten competitive rate. So I appreciate everybody's time. And if you have any questions, feel free to reach out to your Cornerstone rep or your United rep, and we can help you out more. I'm going to pass it over back to Ray, and Ray's just going to close it with specialty benefits.
Thanks, Ed. It looks like we're right at about time. I've got a couple slides here on UHC specialty. A couple things that I wanted to note really quickly on the UHC specialty side is that whether or not it's from a network, a benefit, or a cost perspective, UHC small business is very competitive on dental, vision, life, and financial protection products across the board. We provide our most common plans on every one of the proposals that we provide to you. And we have the ability to get more aggressive if needed on our rating. Specifically for dental, we can go down to voluntary dental to a minimum of 2 eligible and 2 enrolled on a voluntary plan. The dental network is very robust, and we are one of the largest providers in the network. We have the Consumer Max Multiplier that is available, and we have the ability to get more competitive on any one of the plans that you're quoting, and we have a robust plan offering. So if you don't see the plan design that you're looking for, let Cornerstone or your United rep know, and we can match the benefits a little bit more closely. Next slide, please. UHC Vision is the same way. We have one of, if not the lowest vision rates in the state of Ohio. We can go down to a minimum of 2 eligible and 1 enrolling on a voluntary plan. We've got a lot of very good strategic partnerships and a robust network of both retail and provider network throughout the states. And again, our rates are right on par with everybody else with a really robust network. We also have partnered with Glasses USA and Warby Parker for really some strategic, unique offerings in the market as well. Next slide, please. And the same thing on life. And anytime you're looking at a life proposal, provide it to us. We can bundle these together, simplify it and streamline it for your small group employers. Really in that small group 2 to 50, it makes more sense, in my opinion, to have everything under one umbrella. So to the extent that you need anything, reach out to your Cornerstone rep, let us know, and we're happy to assist any way we can. I believe that is all that we have. Are there any questions on the MEWA, All Savers, the ACA, or otherwise that we can answer?
I'm not seeing any questions out here.
Well, excellent. We will be providing you with a copy of the presentation for your review. And if there's anything else that we can do to help you out through this busy fourth quarter season into 1/1, we're happy to do so. And we're looking forward to a continued partnership and a successful 1/1. Thank you all so much for your time this morning, and let us know if you need anything else.
Thank you, Ray. Thanks, Ed.
Thank you so much. Thank you, everybody. I appreciate your time.
Thanks for joining today, everybody. Have a great day.